Yeah,
Yes, sir.
yeah, yeah. Thanks for reminding. Actually, it's by default it will be on, uh, but I don't know what happened. But I really appreciate for your observation. So I mean, it's there since a long time, but why it has been growing so fast? If you look into the current trends or in near future, okay, there was a very dynamic change in the industries, in almost all industries, where a lot of things has been digitalized. Okay, there's a lot of automation that happened. There is a lot of predictive analysis that is happening. Okay, and there is a rapid growth or speed in which we need to work. Okay, it's not like the traditional models of manually working on things where it. I mean, I know like manual mode of working is more clerical job, routine thing. But I mean, here there is some system that has come in, okay, which is going to give a better results, okay, save a lot of time, okay, and give us more time wherein it takes all the bulk of the work, what we call in our common language the donkey work, okay, and give us a time to smartly work on other things. And the most important parameter which you need to observe this or with the acts that are coming in various countries on AI acts, like Europe has come out with the European AI Act. It is there, it is there imbibed with the UMDR. Okay, USFDA has come out with this. So a lot of companies, I mean, a lot of countries are coming with this AI acts. Okay, and of course, India has come with the Draft Act, Draft AI Act, long back in, I think, in October 2025. So when these acts come and they are imbibed with our regulations, the compliance, regulatory compliance for us becomes easy. Okay, because ours is a regulatory industry. It's not like we can do whatever like Amazon does or Swiggy does, as Telsa, Telsa or Elon Musk does. Ours is a more regulated one. We are dealing with the devices. Uh, Patient safety is utmost important. And when we use these models, okay, we have to be very much ensured that whatever models we are using, okay, are doing the right work, what we call the governance over it. Okay, humans will have the governance over it, and humans has to interfere in the final decision making, not the AIML system. Please underline this. Because if something goes wrong with the decision making, I mean, whatever activity you take, it could be, I mean, the worst case could be a clinical investigation or a clinical evaluation report where you 100% depend on the large language models to comply your CER or even your PMS trends. Suppose there is a drift, I'll explain you all this stuff. There is a drift that happens, okay, over a long period of time where the drift prediction or prediction may go wrong. Okay, there are a lot of things which we need to have a government so that the decisions made by the AIML, okay, are totally under the control of human intelligence. Okay, so whatever report that you prepare with the help of AIML, okay, has to be signed by the concerned person, and you will be held responsible if anything goes wrong, not the machines. Okay. Of course, like in 2025, when AIML came in, it has not percolated into most of the domains, but in the few domains where it has entered, people thought like AIML is going to replace a lot of jobs. Okay. Like what happened in 1991 when computers came in. It's people thought that mainly in India, people thought uh, computers will replace the jobs. I mean, that's That's not right. It's a pure speculation and a wrong speculation that AIML won't replace your jobs. Actually, it will enhance or support your work, okay, and provide you more responsibilities. Like you can allocate a lot of time for other activities where the machine learning tools will do the regular exhaustive work. Okay, when you have a lot of data that has to be compiled or worked on. Something like I'm talking about clinical evaluation. Okay, where we need to collect a lot of literature, searches. Okay, I mean, do the data analysis, separate them, write the compilation of C. This all can be done, okay, with machine learning, even the PMS, even the PSUs. Okay, I'll tell you the application. There is application even in the quality system in ISO 13485, which I'll discuss. So, I mean, what I'm trying to make you understand is like two things. Don't be in a LB or in a confusion that AI is going to just work for you and whatever AI decides is final. That's very wrong. Okay. And second thing, you need to understand that when you use AI, you should have absolute governance on it, like what the machine is doing day in, day out, or what are the platforms doing day in, day out, and occasional recheck and validations. Okay. And the most important, I said, like you need to take the responsibility and sign the documents. It's you can use AI for a lot of critical decisions. Okay. But end of the day, no, this is what we call the industry 5.0, 5.0. What is industry 5.0? Okay, industry 4.0 is just like machines doing the human work. Okay, whatever work the humans has to do, the machine has overtaken it. Okay, and there was a concern like machines may overtake the humans and there will be unemployment. But in the industry 5.0, 5.0, or what we call uh, the hybrid intelligence, okay, it is more AI empowering the human intelligence. But it's not like AI will take abrupt decision or it becomes autonomous, taking decisions of its own. No, it's not like that. It is called as hybrid intelligence, where AI and human intelligence, AI and HA has to work together. In our domain, it's for good for patient safety or reducing the risk or for new innovations or do some predictive analysis to understand that an adverse event is going to happen before it happened and we work on it. Okay, we have to able to predict, I mean, a lot of things like it will enhance the design and development process, like will cut short the time by more than 5 years or 6 years. Within 2, 3 years, you can have a prototype. You can do clinical validations with AI models. That's what I shared some notes in the group on digital twins. I'll explain to you. With digital twins, there is a lot of use, uh, including all validations, even your sterilization validations you can do, stability studies. Okay, so that's the importance. I mean, I I know like in next 1, 2 years, everything will be digitalized and every domain in QARA, basically in medical devices, is going to uh, overtaken by or somehow. I mean, if you want or if you don't want, well, that is your problem. If you want A and say, okay, it's come. If you don't want, I'm telling you the bitter truth. Okay, difficult to swallow. you need to, it is going to creep under from the carpet into your house or into your workplace, into your domain. Okay. Of course, people should not be afraid if AI is coming into their domain. They should be, I mean, like ready for that, adopt it. If you are not able to adopt it, see, somebody is going to replace your position. Those who are good at AIML, they will replace you. Okay, I mean, that's what I told to some earlier. It's, I mean, at least you should understand. Not again, I'm repeating. It's not like you need to learn the coding languages or the maths behind it. You should know at least the applications of various models, how it can be used in your activities in your domain. Okay, and I know, like, end of the day, it is going to become more a closed loop system. Okay, where AI can take part in almost all the activities, and you have to be, it has to be human centric. Okay, like I'll tell you like how agentic AI is doing work autonomously. Okay, it takes the decision and knows what to do next. But that's, I mean, that doesn't fit in our medical device domain, basically in QARA. And also there are AI agents. Of course, I created some AI agents which respond or which do work, okay, without our authorization or say, replying to emails or on WhatsApp messages. But we need to be careful that sometimes I mean, it goes so stupid. I mean, it sends wrong messages. Okay. I mean, just coming to what you call a bird's eye view of how these AML systems develop. Okay. This is the model architecture. I mean, this is what we will be learning a lot on the machine learning platforms. The other day I told you it is the two basics, that is supervised learning and unsupervised learning. Okay, these are the basic core of machine learning that have come in 2021, 22. In supervised learning, you have some models like linear regression, which a lot of you know. Okay, you have logistic regression, which I discussed. But just I'm trying to make you understand or recap what I have done, because last time also I missed recording that session. So hence I just shared the Google transcript, I mean Zoom transcript. Then you have unsupervised. Okay, where I'll tell you what's the difference between supervised and unsupervised. In unsupervised also you have a lot of models. Okay, then you have computer vision or object detection. Okay, there are like NLP, natural language processing, LLM, large language models. Okay, then there are decision trees, which are very complex, but still you can learn. Complex in the sense I'm trying to make you understand, complex in explaining to the regulators or the auditors that I have done this to decision trees, or what is called random forest models. Okay, they are at a very high level. But overall, supervised and supervised learning, the models in that, okay, uh, all the models like the object detection or computer vision can be used, gladly accepted by the auditors. NLP you can use, natural language for your PMS and a lot of other things on complete identification and early signal detections. Okay, like large language models you can use for your C or, but remember it gives only the drafts copies, drafts, like of course it gives a lot of information in the draft, but you need to review and work on that. I'll tell you like in each and every regulation or annexure wise, I'll tell you, or annexure wise in UMD, or I can tell you, okay, how you can use this application with an example. Maybe clause wise, I'll tell you in ISO 13485 how you can use it. Okay. But again, I'm repeating the same. Okay. We we are going to work this all this stuff with ML models. Okay. With perfect regulatory compliance, and we have the governance over AIML. I'll share all this data, how to have governance on that, because governance in the sense you are being responsible and you are regulating all the stuff, okay, with some cyber securities so that nobody can infringe your data or hack your data and disturb it. Because this becomes very critical in AI when it is used in diagnostics. Okay, there could be false positive, false negative results that come when what we call if the model is changed. A lot of people, a lot of hackers do this, and mainly, I mean, in AI robotics also, surgical robotics. This is very, very crucial on cyber security. Okay, patient health information, PHI. Okay, how you are doing that? Because say a surgical robotic which is trained, I'll tell you an example like which algorithms or which platforms or which models are used in ML for surgical robotics to operate. Okay, and how do they operate? They have a combination of object detection, okay, computer vision, which almost are same, but there is some difference. Object detection is much more advanced than object detection. They also use what we call the complex models like decision trees or random forest. Random forest is still more advanced, but they won't use agentic AI or agents because agentic AI is autonomous. It takes decisions and it does what to do next. So without human intervention, it takes its decision, okay, and it further progress to the next or navigate to the next activities without the human intervention, which are sometimes useful in other domains but not in medical device domain, because for us the bottom line is safety, safety, safety. Okay, patient safety is very, very important. So here we will be learning all these models, the 10 models which I have shared in machine learning, and we will be working, we'll have hands-on experience. I said we will be working on ML Azure, that's a Microsoft machine learning Azure, where you have all these models which I have discussed, and of late they have also adopted other models. Okay, and there is one called OpenML. OpenML is more like when you don't have when you have unsecured data or the data that can be open public domain, you can use it. But when you have a data which is confidential, better you subscribe to them. But as of now, we don't subscribe in our regular training programs. We'll take them free, like OpenML or ML Azure. And also there is Colab or Microsoft Colab, which we can use all these 10 platforms, 10 models. Once we have some data also we can download from Kaggle. Or this is not real data, this is basically the synthetic data. Real data general comes from the patients or from the hospitals. But we can synthesize some data, whatever data we want, that's already available in Kaggle. I mean, there's no need for us to uh, sweat over it. Then use all these models for a particular activity. Suppose I want to say like, I want to work on something like on, uh, it could be anything on design and development. Okay, how I do the prototyping, how I do the design validations. Okay, I can pick up some models. I'll tell you which models you can pick up for each activity. Okay, I want to work on risk management. I want to work on something like in the QC or in production. I want to work on what is the acceptance and rejections of how it can be done. You can use object detection or computer vision. You want it in a more moving to more text related structures. You can use NLP for identifying your complaints or pop or all this stuff. I'll tell you. And you can use LLM, large language models, like what all these generative AI is using are LLM. I'll explain you detailing. All these GPTs are generative. What is GPT? It's generative pre-trained transducers. They are already pre-trained. Okay, you also has to train some model which is fit for you. Okay, and once you train and validate that particular model, okay, and as an when you give a new data, okay, what we call input data, it processes the input data as per the training which you have given for the, I mean, the historical data or other data what you have found, okay, and it will give you the outputs in fraction of seconds. There are a lot of things, a lot of models that can give you, like you can adopt in your QC, you can adopt in your production, you can adopt them. I said PMS, PSU, or clinicals, risk, okay, even in usability, and also on most of the clause in 13485. So here we are lying using all these models. And of course, of late, like the, I said natural language processing is something which came early, but after NLP, the most advanced that is now, I think most of the people using, okay, that came from uh, X or that like Group or ChatGTP or anything like which are generative AI are using these LLMs and embedding models. I tell you how they work. Okay, large language models, and that's what we call generative AI. Okay, it has been evolved from machine learning. This also we will use LLMs and generative AI also will use in some of our clinical investigation, evaluation, PSU or PMS, total PMS structure we can use using LLMs, generative AI. That is, particularly I'm talking of NLP uh, and LLM. Okay. This side talk agents also can be used, but I tell you what are the bottlenecks or what are the limitations of using AI agent. I'll also help you to understand how these AI agents are built and how it works. What is the core concept? Yeah, it's like I'll discuss with you core concepts of all these ML platforms, ML models, how they work. But I don't go into the coding or maths of it. If you want to understand the coding of it, that's a different story. Like you need to learn Python. I know a bit of Python because it's the easiest one to learn compared to COBOL or C, C plus or Java. Python is the easiest language to learn for coding. And Python is the easiest language actually, which came much before all this stuff on Java, COBOL, COBOL plus CC. It's a very oldest language, but the advantage with Python is that you can write or you can do coding very easily. It's a very simple language. You can do very fast, okay, and do coding very pragmatically for the AI. Okay, AI don't want a lot of complicated codes that involve Java or COBOL or all this stuff. Python is very simple. Okay, that's why Python came back again. We thought it became absolute. Python sometime back for people thought when I'm in maybe in my PhD or much before that, I thought Python is a useless language. But again, it rebounds back. Okay, like it became one of the most important language in AIML for coding. Like you would have seen a lot of things happen like that when we think that they are what we call absolute redundant, can't be out of the picture. They will resurface back at some point. You can quote a lot of examples, like I can quote hundreds of examples, like simple aspirin, okay, which has a lot of problems. That problem has become, without aspirin is out of the market because of its side effects. That side effect has helped it, okay, now it to be used as an antiplatelet drug, okay, for cardiac problems or stroke. It's a first line drug when you have a cardiac stroke to take aspirin, or the other is isosorbate nitrate. There are a lot of examples I can quote. So never disregard those which have become obsolete or which have been out in the present context. So guys, what I want to say is that we'll be talking on all these models, LLMs, generative AI. I'll touch upon AI agents also. If you require, I can talk because this becomes autonomous when you enter into AI and agentic AI. As I have mentioned, they are coordinating agents toward long-term goals. So they coordinate with each other. See, couple of AI agents become an agentic AI. Because suppose I have four AI agents, I interlink them. Okay, when I interlink them for a particular work, okay, they take decisions and knows what to do next. Like I say, my rejection rate is high, 95%. Okay, then it takes its own decision how to reduce the rejection rate with the next AI agent. The next agent will change the algorithm or give some decisions or some comments. Okay, then uh, it will advise the another AI agent. Okay, maybe linked to raw material or where you have a lot of rejection because it finds the root cause. Like it could be because of raw material or it could be something related to manpower training or machinery. Then it will command the other AI agent that this is the one you do this stuff. It can be branched or it can be looped. All AI agents when are looped become agentic. Agentic in the sense you have a continuous autonomous loop working. Okay, but it's for long-term goals, mainly used in banks, this LICs, retails. Oh, but I know like nobody is using. I know agents are used in medical devices, but we have not entered into agentic AI. This is what's the latest happening in AIML. So if you see the sequence, how these have developed, okay, I really appreciate like you can also see like as we go up into the advanced model, there is a lot of risk involved. Okay, uh, human risk involved, and for us as a medical device bound to have a lot of regulations, we are constrained with as the risk increases, the regulatory compliance, okay, decreases. Okay, because as I said, it has to be human centric, not that a machine learning takes everything, every decisions. So you need to be very careful in choosing your models, which I am going to help you which models to choose for which activities. And as I tell you how to open this Microsoft ML Azure, how to register, how to open the models, and how to get your data, input data. Once you feed the input data, what models can be used? Because in models also there will be some sub models. A lot of options will be there for you. Or it's like you enjoy plug and play. But I also tell you what are the outputs you have to be very categorical in knowing your outputs. what outputs you are expecting. I mean, it's not just the outputs, what are the performance metrics we call it? What is the performance of the output you are expecting? Suppose I want a model to be accurate 98% sensitivity, no, as 99 specificity, precision, accuracy of the model to be, I mean, as close as the best. Then you need to work on training the models. Okay, work on just plug and play with the models, like check which one is giving, but with a lot of logic. It's not that uh, it should not work like a layman just trying to use everything for every data. Okay, when you have a data, you should know what these inputs are. Okay, and what are the machine learning platforms which you should use, and what is the output it is giving, and how you measure the output, what we call performance metrics also. Okay, I'll discuss all on that. But as I know, this is the story on, if you look at a macroscopic level. Okay, but if you dive deep into this, you will, I mean, the good thing to enjoy AIML is you need to understand the basics. Okay, once you understand the basics and you keep applying them to different data, like I do this, like I apply a lot of AIML in predicting, okay, predict analysis, like will there be war between Iran and US, or Venezuela and the US, or what is going to happen to India medical device growth or general GDP in 2026. But when you do general application, it keeps interesting. Of course, you should have that same affinity to work towards your professional works. Okay, that is what I stated is something more a general current affairs. But you need to implement that in your system, at least, I mean, after completion of the course, I mean, during the capstone project, I'll tell you how to, I mean, at least one activity, one model that you can implement in your organization. Okay, I know like you people are at different positions, okay, different work responsibilities, but still I can find a way, okay. It's not that I want to poke my nose in your work, but if you have that space to work, okay, if you have the space to work and still you are not doing that, I'm afraid like there will be somebody sitting who can capture that, okay, and displace you. So start discussing, start using the language of AIML. That's the new normal. Okay, I've shared with you a lot of glossary or the terms with definitions. What this some of these words means, like if it is GPT, everybody knows what is chat GPT. What is the full form abbreviation of GPT and what is how it is done? Okay, I can quote hundreds of examples. We call hallucinations in AML. Mainly in LLM, it has what we call hallucinations. Okay, there is something like drifts that can happen. In your simple chat GTPs, you can find hallucination because ML models have memory. You ask one thing, because of the memory, they provide you another thing, which which seems to you like a fact, but that is absolutely wrong. Okay. And there will be some called black boxes. Okay. Some called overfitting. Overfitting is because you don't have clean data. Input data has to be clean. I'll tell you how to clean that data, input data. So what happens is that when No, I know like there are a lot of limitations where we need to work on is hallucination, black boxes, overfitting of data, underfitting of data, okay, drifts in the data, drifts in the outcomes of the data, okay, the noise levels, because of the noise. Okay, the noise is not what we find in analytical methods, that there's some noise, signal to noise ratio and HPLC or LCMS, something like that. It's a noise because of your data that is not proper or clean. There are a lot of missing values, you have not properly labeled it. It becomes a noise. Okay. When you have a noise like that, there will be a lot of data discrepancy and the outputs you get may not have the required performance. So we'll be discussing on all that, and you can tell me like which model, start thinking of it, which model and which activity, which model you can adopt in your system, not necessarily in your organization, but if it's in your organization, it will be good. And start speaking in this language that you are good enough, okay, to understand AML, machine learning platforms and models. Okay, then I'll start with the basics. I'll explain you with the concept, like what, how these models function. Okay, like machine learning, I said, is a subset of artificial intelligence. Okay, it's a subset of artificial intelligence. I mean, I'll go with the definition, like the statement, sentence, what is provided. Uh, is a method where a system learns patterns from data. Okay, once you provide data, it, yeah, I'll come to that. I have this bad tendency of telling something very important before before it comes, before I mean, when I need to explain. I skip it and move to other topics. Okay. Uh, System learns patterns from data instead of being explicitly programmed with rules. Okay. See, in human intelligence or learning, we have some rules which we need to follow. For any of these things, we have some rules and regulations, okay, which we need to follow, mainly interpreting the data or taking the decisions. Okay, whatever data it is, just I can, when you think of data, don't think them are only numericals. Here, data also includes text. As I said, large language text, even, I mean, 100 pages text can also be a data. Okay. An image can be a data. Okay. Your QC samples, okay, your production data, your machinery can be a data when you take an image and try to understand what's going on. Okay. Don't presume that data is only numericals. The, the beauty of ML is it can turn anything text or images or the voice, okay, any language, uh, into what it, for what it requires. Like suppose if take an object, it doesn't take object, it will take the image, but it won't perceive that this is so and so image. Okay, it pursues the image in the form of pixels. Okay, pixels in the sense, and what is the background of the pixel, and this is how the most of the diagnostic equipment work. Okay, if you want to learn whether it's a tumor or there is no tumor, okay, it takes out the pixels and tries to understand that particular pixel. And if you go, if you zoom out, it will understand what is the cell morphology of it. Okay, and when you compare the cancerous cell morphology structure, and if you go in depth into the nucleus and the cell organelles like the vacuoles, mitochondria, and compare that with the normal cell, okay, normal functional cell, you find a lot of difference. That is what machine learning in object detection, okay, at least in computer vision or in object detection, both are slightly similar, but object detection is still more advanced. And that's how it diagnoses, okay, that this is a cancerous tissue. And I think last class or somewhere I told you why it is better than the oncologists who are diagnosing it is that a AIML can identify even a single cancerous cell. Okay, don't need a lump of tissues or group of cells, tissues to know, like how oncologists do. They do a biopsy and then look under a microscope and then try to understand, okay, this is okay growing, or there is some mass of cells, hence it has spread or benign or malignant, all this stuff. But when you view an CT or MRI scan report or the image of CT or MRI scan, it can identify by object detection even a single cell if it is cancerous, because the basic concept of that is differentiating between the normal cell structure and a cancerous cell structure. Okay, it can go in depth into understanding the difference between a nucleus or even a chromosome in a cancerous cell and also in a normal cell. But again, I repeat, after all these things, diagnosis and XYZ, the oncologist or the oncosurgeon has to take the call. So it doesn't go by rules, it understands its own patterns. Once you give the normal cell structure and a cancerous cell structure, it can identify even the grading, whether it's type 1, type 2, type 3 cancer or benign or malignant cancer. That is, I say like, I love this. The beauty of this is with the patterns, it can identify a lot of things. Not only I'm talking about diagnostic tools, okay, very helpful in a lot of what you call diseases where you need to diagnose or identify early. Okay, it's really so helpful. The whole diagnosis, to my understanding, the total diagnosis scenario has changed after this AML has come into the medical field. Okay, where early identification, early diagnosis has become, so you will have some options to treat it, whatever treatment you want to go for, surgery or XYZ. Okay. In traditional software, rules are first written, then we follow the rules. In machine learning, rules are inferred from the data. It's it's not like it doesn't have rules, but based on the data, what is the input data you provide or what is the trained data you provide, it frames the rules. I think that should be, the best option, to have rules based on the historical data, okay, or something like on your trained data, what we call pre-trained data, what you're giving it as an input data to it. So it frames rules. Okay, then once you validate it with some test data and see that, okay, my training has done well, and the test data, when you give it, the test data is also showing everything right, like it is a true positive, true false negative, everything is right, accuracy is good. Then what I'll do is I'll give another test data or individual patient data to it, because I have trained it, I have validated it, I have tested it with few more data, whether it's like writing an examination, I told. Okay, training is something, it keeps learning, training data. Okay, validation is something like you provide the test paper, question paper, and test is like test data is something like it's an exam whether you passed it or not. Once it passes with some percentage, we don't know, like you need to look at what are the performance metrics, whether it passed with 95% accuracy, so much of good precision. A lot of terminology will be there on ROC or area under curve. Okay, all this terminology, if it passes well, then you next start giving the patient data where you don't know what will be the result or the decision of that, because it's a raw data for us. So we give that data to the already trained, validated, tested machine learning platform or model. Then it will provide you the results, whether, I mean, whatever it's accepted piece or rejected piece, there is signal, I mean, there is a trend in the complaints. There are early signals for new complaints or new adverse events. There is a trend that is happening in your FSCA, or your clinical evaluation has to be improved with sort of, you know, state of art technology, or you're still not relevant to this. A lot of things, guys. You'll find a lot of applications. Only thing is that you have to use a lot of your common sense. I don't say this is a big thing that something like you are working in ISRO for a rocket or PSLV. Unfortunately, our PSLV failed a couple of days back. It happens. Nothing to worry. So it's not such a difficult, it's just a common sense and few logical things. Okay, and again, I am telling you, you are born to make mistakes. Even the experienced data scientist, the one who calls the best in AI, can also make mistakes. Okay, mistakes are accepted. And in AIML, there are nothing as stupid questions. Every question is valid. Okay, you can ask me a lot of questions. Okay, so this is how this the when you go in depth of how these machine learning uh, platforms or algorithms frame their own rules. Traditionally, we have rules and regulations that we follow them. Now we are having a set of rules that are framed by the data that you have fed into the algorithm or into the platform, which follows a, I mean, this is what is important. It has a pattern, it forms a pattern of what the data you fed in, and it derives rules from that patterns and from that data. Actually, it's good that because it is concurrent. Okay. Once you feed that your new data, or you want something to be decided by the trained, validated, tested machine, you will get really exact data what is relevant and concurrent. Instead of following the rule-based, okay, rule-based system, which could be relevant or which has been absolute, okay, which is a decade back it has been done. I know, like it, some of the rule-based system are still good. Okay, and rule-based system, or I also know that in some of the algorithms or platforms, they form the what you call the foundation for the ML models. Okay. And as you know, machines doesn't understand what is reality. They approximate patterns that existed in historical data. Okay, and you should not be very much concerned about that. Before I jump into this, I think I explained. Can somebody tell me what is the difference between, because this point I discussed last time. Can somebody tell me what is the difference between supervised learning and unsupervised learning? What is the difference between supervised and unsupervised learning? Or you tell me what is labeled data and unlabeled data. You can Google and tell what is labeled data or what is unlabeled data. Or straight away you can tell me what is supervised learning or difference between supervised and unsupervised learning. Why supervised learning is the best option in many domains. I'm also giving a clue that you can depend a lot on supervised learning. Yeah, I said there won't be any stupid answers or questions in this. Just you need to answer whatever it is.
A
In
labeled
super,
data which existing output inputs, unlabeled data which is not existing outputs.
Yeah, extra light. Yeah, it's she what Leela has said is very close. See, labeled data is something like you know what is the input and what is the output. Okay, basically you know and you label it. Okay, what is the output? You also know it, and we call it as a word what is called as ground truth. Okay, you label your X and you label your Y. X is your input data and Y is your output data. You label them. Okay, X is something like a thickness of some material. Okay, Y is 2 mm or 3 mm. Okay, that is right. Okay, that is the ground truth. The thickness of that material is 2 mm or 3 mm. And you give a lot of information to it, a lot of data to it. I'm just generalizing it to make you understand. You give a lot of data of various thicknesses of a particular item, 2.3, 4.5. I'll show that later. Okay. And that is the ground truth is you have already measured it. And you have know what is the X input data, what is the Y output data, and that is labeled. You label the variables. Okay, the variable could be, I said, could be a diameter or thickness or something. Okay, and your output is some numerical. It sometimes it may not be numerical also. It could be some decimal like 0.1, 0.2, 0.3, or sometimes it is yes or no. Okay, we'll look into that. But as Leela said, it's more like since you have labeled what is there in supervised learning, it is more relevant, it is more predictive that it will give the right information for your unknown test data. Okay. Whereas in unsupervised learning, you don't label it. Just you view the raw data as such, okay, without labeling it, like you don't say anything on whether it is the thickness or it's so and so. Okay, and you don't provide what is the right value, right one. Okay, suppose in labeled one I say 5.5 plus or minus 0.0 is the right value. Here I don't give any right value or the mean or anything. I just pump the data into that unsupervised learning. And what it does, it takes up all the data and forms patterns of the data. Okay, I'll tell you like how it forms the patterns of the data and it predicts. Okay, it does some conclusions out of the data. But at the end of the day, we need to explain what is the model used, how it formed the patterns, whether the patterns formed are explainable, because unsupervised models are also used in a lot of applications in medical devices. As I said, the governance on that model, the reliability on that model, okay, the explanation of the outcomes of the model, of course, the training or validation, all this is important. How you train that model. But basically, we give data which is not labeled like in the supervised learning. Okay. And I also discussed the other day, linear regression is a very simple which we have used, which have been using over centuries and still continue to use on linear regression in the data because there is a correlation between the X and Y. Okay, whether you label it, okay, there is a correlation either as you increase the X, okay, the Y will either increase or decrease. There is a correlation coefficient which tells you by what we call it's a simple equation of a straight line. Y is equal to mx plus c. C is the intercept which passes through the zero. Okay, that's the initial value. Then you have a slope. Y is equal to mx plus c. Okay, m is the slope. Then you have y and x variable. Basically, you need to calculate y variables. Okay, sometimes c can be zero also. Intercept can be zero. So here you will find a linear relationship within our input or output, or it could be linear. Okay, either it is directly proportional or indirectly proportional. I'll show some images. If it directly proportional, as it keeps increasing with the input data, the V is also increasing. Okay, you will have a positive slope that passes from zero, intercepts at zero and goes, okay, increases. Here the slope dictates everything. Whether slope has a 45 degrees, okay, whether slope is flat, but it is a linear one. Okay, the angle of the slope, I mean, that's what is very, very important here in linear regression. What is the correlation between the x and y? Suppose if it is decreasing, there is a negative correlation, then your graph will be on the other side. Okay, I'll show the graphs. The graph will be traveling from your x-axis, sorry, y-axis down towards your x-axis. It will be a negative one. It's called negative slope. Okay. If it is a positive one, it travels from zero. So these are, I mean, very commonly used. I will be stupid to explain all this stuff to you, but it's important how you interpret them in AIML. But that's the basic point. Okay. Because I'm running through this fast. In the next session, I'll come really to the core concept of what this does for our QARA with examples, and I'll tell you what are the limitations, okay, what the auditors look, and what is the regulatory compliance for this. Okay, for all things, suppose if I use linear regression, the most appreciated model, or even logistic regression is also most appreciated model in supervised learning. By the auditors, not by me. I like different models, but the auditors like this because it has minimum explanation to do and more reliable. The outcomes are more fine-tuned. Okay, because again you need to say what Leela said. It's a labeled data. Labeled data you can rely more. Okay, this also in logistic regression, I'll explain it better when I come to that. Okay, used as a classification, not prediction of values. See, here you have a series of values. Okay, series of values where there is correlation between the input and the output. There is a correlation which comes in the form of a slope, or we call it as correlation coefficient, that is R square. There are different names to that. But in a logistic regression, what is done is it does the classification. It says yes or no, accepted or rejected. Okay, and it give values from 0 to 1 only. Okay, you need to convert, if you have any text also, you need to convert that into numerical. Either you give 1, 0 or 1. It's basic classification, acceptable, not acceptable, disease is there, disease is not there. Okay, in simple uh, like fractures, X-ray fractures, but not, it's not used in complicated ones. But in our scenario, we can use it in a lot of applications. Okay, it gives what you call as probability. Here in linear regression, it gives, if I give X, okay, if you give the value of X from the pre-trained model, it gives me the value exact decimal value. From decimals, it gives me the value of Y. And it can do a lot of other things. It can give, I mean, that comes in statistics when it can give me what is the frequency, what is the mean, what is the average, what are the scattered points, what is the standard deviations. Okay, what is RST related to standard deviations. Okay, linear regression gives a lot of performance metrics. Okay, what are the basic outliers that are there, that are totally drifted from the linear line, what we call it as a best fit line. From the best fit line, how close are the points, or how scattered are the points? If they are scattered around the best fit line, it is the worst data. Okay, because your values are not in linear mode. Okay, if there are 1, 2 data points which are, outliers falling outside the trend line, best fit line, still it makes a lot of difference to your data, which we will learn. Logistic regression is basically a classification. It gives the probability between 0 to 1. Okay. Suppose if it is, you feed the data, you train the data, and you give the test or individual data, it gives a probability like 0.2 or 0.3. Okay. It does not predict, it gives probability. What is probability? The probability is that it is 0.2 first, 0.2, or generally probability will give them, what in the terms of percentage. Okay, 0.2 is, it is 20% probability. This is 80% probability. But here the most important thing is that you guys, you need to tell what is the threshold probability. Suppose I am getting probabilities of 0.2, 0.3 with my trained data, or after training validating, and I give the test data. Okay. I'll tell you what this S-shaped curve means. This is a sigmoid curve, which most of us have learned in colleges or in schools. Okay. So what it does is it will tell you, you tell me what is the threshold. Suppose I say the threshold of acceptance rejection is 0.5 probability, or 0.45. Okay. Then whatever below 0.45 is accepted, what is above 0.45 is rejected. Okay, this is what we call classification. I'll explain you in depth, but I'm trying to make a basic understand on what this machine learning. But here also in classification, it gives a lot of performance. It will tell you why these probabilities came, how these probabilities came when you have given the data to it. Okay. how it work on the probabilities. It's, see, when you have a probability, you will move away from uncertainty. You are not uncertain, because in lot of manual cases or manual calculations, sometimes you find that there are few where you are uncertain. Okay, but when you have probabilities that are coming out, you can fix your threshold probability as 0.5, or you want anything below 0.7, okay, rejected or accepted. You can frame your probabilities, threshold probabilities, and say these are to be rejected, this has to be accepted based on your, okay, presumption of the historical values. Okay, I think I talked about decision trees also. Decision trees are bit complicated. Okay, decisions are taken as a sequence of questions. Okay, it doesn't behave like a logistic or a linear. Okay, whatever data you give, it splits the data. Okay, it looks at only individual variables. Suppose I have given 5 variables, the thickness, weight, color, that, this 5 variables. It looks at each variable individually with the other variable. Okay, weight and color, how it is doing. Okay, color and thickness, how it is correlating. But it does multiple correlations, or when you give multiple variables, it has a sequence of questions. It asks how one is related to other, the second is related to third, and third is related to one. Okay, it can handle complex data, not like linear regression or logistic. So it splits data repeatedly based on its question. Okay, and here also you can use the threshold. Like if your data is right, it creates a lot of decisions. But end of the day, the decisions will be a combination of, or an average of, okay, individual decisions. For two variables, you get a decision. Other two variables, you get another decision. Okay, as the decisions change, you end of the day you will get a combined decision. I'll explain this, but just for you to know, this is okay. Decision trees are very important. They solve very complex structures, complex data, complex problems. In decision trees, okay, the most complicated is the random forest. Random forest uses multiple decision trees. Okay, it is also a part of decision tree, but as the word itself says, it's a random forest. Okay, it uses multiple decision trees to arrive at some conclusion. So it is much more complex. Okay, you need to really figure it out whether these models can be used, because you need to have the validation done. You should be able to explain, you should have the answers for the outcomes or the metrics that have come out. You should be explain and understand this. I'm going to give examples of the, see, support vector machines are not basically used in medical devices, but it functions something like the object detection or the computer vision, which forms the boundaries and detects the objects. Like how okay, this is unsupervised learning. I said no labels, only data structure is given. There is nothing we can do on labeling. Okay, the core concept is, again I say, when you pour the data, dump the data into the supervised learning, it adopts to the data, it learns through the data and forms different patterns, what we call clusters, which are very similar, data points which are very similar cluster at one point. Okay, and the others which are, I mean, not so similar cluster at one point. So you can, when you work with the machine learning model, you can ask how many clusters you want. It will ask like how many clusters you want. Suppose I say I want 5 clusters, or you can say 3 clusters. So what it does is, based on the similarities of the data you have, okay, you can give multiple variables also, not one. Based on the multiple variables, correlation of the variables, it forms a patterns and it gives you a cluster, and for each cluster it will tell you why this cluster is formed. Okay, whether it's linked to the thickness versus density, or thickness versus the color, or something like that. So each cluster will be very closely linked. Suppose I want 3 clusters, the linkage of the cluster formation will be in a very broad sense. Okay, it may cluster somewhere between, numerically if I say, cluster between 6 to 8. Okay, any value of 6 to 8 or any data of 6 to 8, it may cluster. Okay, 8 to 12, it may cluster, it may form second cluster. 12 to 13, it may form. I'm just giving an example. Okay, it can be independent variable or dependent variable. Okay, but if I say for the same data, I want more clusters, it will give more similarity. It comes more near to the similarity. So the data which is between 4 and 5 will cluster at one, then you'll have 5 clusters. You'll have more clarity on the grouping of the data. Okay, are you getting my point? That is clustering of this k-means. Then in the unsupervised learning, I said there will be one clustering, and the second one is, okay, what we call anomaly detection. What is anomaly detection? Is the data which is not in the normal pattern. Okay, as I said, it could be an outlier or stray data which doesn't fall in the clusters. Okay, there will be 1 or 2 data points. It happens in a lot of studies. There will be 1 2 data points which fall, either they won't fall in the best fit line, or they are so scattered and straight, or either they may, in the cluster, k-means cluster in unsupervised learning, they may not fit into any clusters because their value is so different that they can't come to any cluster. They may be very near to one of the cluster, okay, close to one of the cluster, but won't be in the part of the cluster, in the sense that they won't form a cluster or a pattern within that. So this anomaly detection is basically used in QC, where we try to identify, okay, what are the defects that are there in the QC, because it is also linked with object detection or computer vision, then anomaly detection. Then it will give us what is the problem, what are the data that is an outlier, why that rejection happened, or generally we consider as rejections when it is out in QC. Suppose there is a data point in clinical investigation or in field safety corrective action, that will be very interesting to me. Okay, if there are clusters that are formed, we know the similarities. But if is the date anomaly of a pattern or anomaly of detection that is falling outside the clusters, not in any of the clusters, but outside the clusters, outside the scattered best fit line. Actually, guys, I'm telling you, if you are in PhD or if you are in R&D, that will give you an interesting information why it was away, okay, not within the line or not within the cluster. Generally, it is followed, okay. I mean, I told about one on linear regression. You'll have an curve which is a straight line. Logistical regression, where I said it will be S-shaped curve. Okay, sigmoid curve in logistical regression. I'll explain all that. And you will also find in patterns or in clusters in unsupervised learning a dumbbell-shaped curve. Have you heard of dumbbell-shaped curve? Because in dumbbell-shaped curve, the 50% of the data generally falls within a narrow deviation. Where it will be in a dumbbell shape. Okay, 50% of the data will be in your plus or minus or within your deviation. The other 30% data falls outside this. Okay, either towards the x-axis or the other side. Basically, these 30% of the data which falls outside in the dumbbell-shaped curve will be an interesting data that won't fall within your specifications. I'll tell you a lot of examples why it deviates from your standard deviation or why it doesn't fall within your specification with standard deviation. Okay, why it goes out. In sigmoid curve also we can discuss a lot why there will be some data which don't fall in line or which will be 0 or which will be 1. Okay, I said in logistic regression in sigmoid you'll have only 0 to 1 and the mid is 0.5. What falls around 0.5 is good, but if it falls in 0 and 1, that is a nasty data. It's not good. In linear regression also we discuss. Okay, we are now discussing about a dumbbell shaped curve, which is talking, I mean, this is very, very easy to understand. Okay, suppose you have a class or somebody, some in your company. Most of the natures, if you take any measurements or calculations that happen in your, basically most of them, 80% of them, okay, fall into dumbbell shaped curve. Because suppose you take heights of your colleagues in your company or some size, shoe size of them or weight of them, anything. Okay. The average will be more. The people with average height or weight or length or your chapel size, average chapel size or some size will be more. Okay. I mean the frequency, if you take 100%, 100 people, this happens in patients also, 100 patients or 100 people. Okay, 40 to 60% people will have I think it could even touch 70% in some cases, which will have the average size. Okay, average unit or average variable, okay, which you are trying to find out. The other 15% will be more than the average. Either they will be overweight or they will be having overheight. Either slipper size will be some 8 or 10 or 12. Okay, 8 is also normal average. 10, 12. Okay, that is on the other side. If you look at below the dumbbell curve, I mean, if you once had dumbbell shape, the average persons will be more. What we call, it's also called normal frequency of distribution. Those which are within normal range or normal frequency the number will be more. The frequency will be more. Those who are away from the frequency or normal frequency, like abnormal heights or too much height, not in the average, will be some 15%. Those who are below the normal average height could be some 4 or 4.5. These are shorter heights, those who are shorter, okay, on one side. Then you have who are very taller, okay. 15%, 15%, but those who fall in the normal range will be 70%. Like, so this is called as normal frequency of distribution. It happens in lot of data and lot of population. Whatever variable you take, pick up the sample size and you measure something, it falls in a bell-shaped curve. The extremes will be very low. In the middle, you have more people or average persons, the frequency or the number will be more. This is not my concept, this is traditionally proved. But in anomaly detection, the interesting thing I said is it doesn't fall anywhere. It will won't be in the cluster. Okay, it won't be in the linear, it won't fall on the sigmoid. It will be totally deviated either from 0 at 0 or 1 in sigmoid, or totally deviated in the linear regression, somewhere scattered. In k-means cluster, it won't fall in any of the cluster. In anomaly detection also it happens the same. Okay, if you have a bell-shaped curve, it forms, okay, it falls on the positive or the negative side. It will be very low or it will be either very, very high. Okay, it doesn't come in the normal range. This we call it as anomaly detection. Okay. See, reinforced learning is basically very highest risk category. What we call it as deep learning. Okay. See, I have explained about supervised and unsupervised. Supervised, we learned about linear, logistics. Unsupervised, we learned about decision trees, random forest. Okay. CSV vectors, but that's basically we won't use. Okay. Anomaly detection, we have seen k-means clustering and all this stuff. See, deep learning is, enforced learning is a process of deep learning, which is a very high level application which solves a lot of complex problems because it works similar to that of the human brain. Okay, like how we have neurons. Okay, here also there will be a lot of structures of neurons or different layers we call, not neuron, we call it as different layers of neurons, which is very complex to understand. But once you feed the data, but it gives you the most accurate, what we call accurate performance or accurate metrics, good precision, good accuracy. And the worst case is it may give you totally, absolutely go haywire and give you wrong data. Okay, that is what I said, based on your data and the application. Deep learning is very much used uh, in a lot of activities, even in medical devices. Okay, I'll tell you examples of that. This is what I said, deep learning. It's a subset of machine learning only. Say it handles complexity and non-linear relationships. If there is no relation, say in supervised, we talked of linear relation, logistic regression, and all this stuff. If there is a non-linear relationship, because there is no coincidence of x and y, they are so scattered. Okay, there are a lot of variables. Okay, you have 10 variables, and these 10 variables are not matching to any one of them. They are so different, scattered. Okay, they are non-linear. We also call them as non-linear kinetics, basically, which are not basically. It's difficult to understand this concept, but I know like either it won't fall in zero order or first order or second order kinetics. It will be a mix of everything. Okay, but it is a complex thing, but it will give a very, very good performance. And the problem here is explainability of that performance is very difficult. How this perform, how this deep learning with so many hidden layers like that of human brain neurons, how it perform. Okay. But you will enjoy working on deep learning. Okay, that's what I'm saying. It has low explainability. We can't, as a linear regression, I can explain it much better than any other ML or logistic regression I can explain. Decision trees, random forest, object detection, CV. This we can explain, NLP, LLM we can explain. Of course, they have limitation, but it's easy to explain them. But here deep learning is bit difficult. I'll tell you why it is difficult to explain the performance of the outcomes, because there will be some hidden layers, okay, which are not visible to us. So we need to explain them. Sometimes we find it difficult. Okay, and high data dependency. It it requires high data. If you have very few data, it will be like underfitting. It won't give good performance, and the validation is very difficult. Okay. See, as we move towards more complex models, these are, you find common things like explainability will become difficult, and you want to have a lot of clean data. Your input data has to be clean, and large data is important. Okay, not like some 10, 15 data points. You need thousands of data points. Okay. And validation of that becomes difficult in the terms of training it, validating it, testing it. Okay, because we may not understand some of the complexities in that. As I explain you, what is the concept of that? Concept of deep learning. Okay, this you can see the key concepts almost in all AI models is that you need model training, which I told you. Training of the model is important. Learning from the data, whether you have labeled data or unlabeled data, any ML model you need to train. Otherwise, if you copy some model which is already pre-trained, okay, your data, your performance or the output data will be very discrete and it will be very wrong. Okay, don't depend on other pre-trained models. You train your model, you select your model, give it input data, train it, like which one you want, linear, supervised or unsupervised. In this both, what you want, what best fit your model or activity, what you are looking, output what you are looking. Even the decision tree is also fine. Even deep learning is also fine. But I said the complexity of it increases and you need to have a good explainability, okay, justification why you have selected and how the model performed it. Okay. Model training, validation, it's like say again learning, you're writing, first you learn it, then you, okay, test it. You will have a question paper, you will have validate it, then you have a test data. Overfitting, I said, it is because of noise. Noise is something, it learns noise. Okay. What is noise? As I said, it comes from the input data, your raw data. If it is not cleaned properly, if there is so much of scattering of the data. Okay, as I said, as I told you, all of them find somewhere fit into the cluster or on the linear regression or on the largest regression, the straight line or the sigmoid or on the bell shape. Okay, but there will be some data which is very discrete and there will be some missing data. Okay. When you have this kind of data, which is not in, it's sometimes I said it's also good to have the data, but you need to understand that there is a noise in your data. That noise may affect your performance of the data. So you need to clean the data. I'll tell you in the model only, in the AIML model only, you'll have options how to clean the data. Whether you want to fill the missing values or you want to delete the missing values. Because suppose you have 10 variables. Okay, one variable and you have 100 or 1000 data points. You have 10 variables. Okay, one variable, okay, there may be 20 places, one variable in 100, there are data missing in 20. Okay, if you still use that data where there are missing values, it creates a lot of noise. Because the machine learning algorithm don't know whether it is 0 or 1 or is there some value in it, because you have not filled it. This is missing. I'm talking of only one variable. If there are 10 variables and all the 10 variables, if there are some missing in the 100 data points, so they are missing in some other variables. Okay, the missing data, or there are some data which are so erratic, like if the mean or average is 10, you have uploaded that, I mean, somewhere it goes wrong because of manual or because of the system, it 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 shows 1000. Actually, it has to be around 10 and 100 or 10 and 50, but it has shown 1000 or 10,000. It happened when I was working. When there is such a discrete, I mean, where is 10 and where is 1000? For a particular variable, a data point I am talking. This will create a lot of noise. Okay. And I'll discuss more on noise, how to reduce noise and get them as signals. Something like we find in analytics like signal to noise ratio. If signal to noise ratio is more, we call lower limit of detection or quantification gets merged in the noise or signal to noise ratio, it won't be visible. Similar to that, there is any data that is there in the noise that won't become visible. Okay, the noise become prominent and the data point which is there in that noise will not be identified. It gets submerged in the noise. So we need to remove, clean the noise, similar to how you do in your analyticals like HPLC or LCMS. I mean, even simple spectroscopic analysis. There will be always noise, uh, which disturbs the even the quantification of the data when you do L HPLC, LCMS, spectroscopy, even FTRA, something like that. Okay, generalization, able to perform in real world conditions, that is formed when you train the data and you validate the data, it performs very well. Okay, but when you give the real world data, okay, it may not be able to perform, but it has to perform the real world data because again, I'm repeating, your trained data should also be the real world data. Suppose I am restricting to a particular gender. Okay, my data is particular race or particular gender, particular age, and I trained the model, validated the model. Then my input data, which I am giving, okay, which I am providing the input data to tell me what is the performance or what is the prediction of these unknown values. It gives you wrong values because in your input data, what you have provided or what we call trained data you provided, you have not considered all the variables. You have considered only certain age, okay, certain gender or certain population, okay, certain weight of the patient. If that is an important variable that decides the decision of that particular machine learning platform. Suppose if weight is very, very important, you have taken, okay, weights of all the person. Of course, there will be a lot of variables, but you have taken weights of all 100 persons who are adults. Okay, you have taken other variables also, their gender, X, Y, Z, Z, Z. Then what you have given for your test data, you have given the weight of the infants or some young people, okay, or children. Their weight will be very less, but you have trained it on adults whose age is, whose weight is more, whose age is more, and you have given the test data where the age is less. So it is not in, I mean, correlation or not following what is has to be predicted. This creates, okay, what you call it as black boxes. Okay, it will give you wrong data, that's for sure. I mean, wrong data, that will be output data will be wrong, or it will have a lot of error. Okay, and that is why we say that you need to revalidate based on what test data you are having. Your trained data should also have the same variables. Okay, don't give the test data, train the data. Okay, don't train your data. Okay, train your train your machine or a particular algorithm on adults and use that trained model for using, I mean, taking the data from the children, okay, as the test data. It basically what we call, we need to do a lot of randomization of the data in your input data. You should consider all those variables which in future you will be using as test data. It could be ethnicities, it could be gender, weight, different disease conditions. Okay, these are very, very important. Some clinical parameters like their creatinine or LFT, their CBP, their hypertension or blood pressure. So we need to include, that is very, very important in generalization. Otherwise, when you give the real world data as test data, it will go wrong, or there will be some error. Drift is the model behavior changes over time. So drift is something like it goes up or down after some time because you have not used the concurrent data which you will be using for your test. The simple thing, I mean, to avoid drifts is that you need to keep training the model, okay, with the concurrent data or the latest data. You should, it's a very simple thing. It's not difficult. Only, I mean, I said the other time also, the important, okay, thing in machine learning or anything worth more than gold is the data. So you need to retrain them every time if you find drifting of the data, because it could be something historical data, or this the new data what has come may have few other variables which are not captured in your previous trained data. Okay, then what happens when you give the test data, it has some variables which you are not captured in the pre-trained data, and it started drifting. Drifting is something, it could be positive or negative, but there is some error in your output data or your performance matrix. This drift can be managed by pre-training it once you find that there is some data drift. Okay, generalization, overfitting, validation model. Okay, this already I described. Discuss logic is fixed rules, learned patterns, behavior is deterministic, it is probabilistic. Traditional software are basically that determined. I know like there are a lot of software like GraphPad, Prism, Minitab and all this, which will give you more deterministic, but here probabilistic because it learned through patterns. Okay, it doesn't have uh, something like fixed rules. Validation, you find it very exhaustive validating it. It is more statistical based. Risk, okay. Here you predict risk in traditional software, but here you also predict risk, but it is data dependent risk. So based on the data and the patterns and the trends in that, it will predict. Governance is code focus, it is data and life cycle focus. You need to have governance on it. This is very, very important governance because mainly in SOMET, not in QARA, but basically in software as medical devices, we should have absolute good governance, what we call PCCP, predetermined control, predetermined change control procedures. We should also have uh, algorithm security or also what we call cyber security, uh, protection of the patient health information. All this will come under governance. Okay, these are all the things what are included in A Act or UA Act or in any acts of that. This becomes very important and you should have governance. Okay, as long as you using that AI or ML models which you have trained, you will be having governance and you will be taking the responsibility of that. If it gives wrong right results, fine, wrong results also, you should be taking the responsibility. Okay. Uh, with this, I'll close for today. And next Wednesday, we will have another session where I'll go with examples on each machine learning tool. Okay, and we'll study what are the applications in the QARA and how it has to be worked out stepwise. Okay, it's more a conceptual, stepwise how we need to work out what are the inputs, what is the machine learning algorithms which will work, and what are the outputs, what we interpret, how to interpret the outputs or the performance metrics. And the most important thing is after working on the performatic metrics, what the auditors look at, whether we are having compliance with the regulations, what are the questions asked, how the QARN need to be prepared when you adopt AIML during the audits and regulatory compliances. Okay, as I said, as you move from supervised to unsupervised, unsupervised, you may not find so much of constraints. But as you step into deep learning, okay, even random forest decision trees also you won't find difficulty. CV and object detection you don't find. NLP you don't find much constraints from auditors or compliance. But LLM, large language models, you will have a lot of things to explain because it LLM has a problem called hallucination. Okay. Uh, and of course, the general problems, as I said, are overfitting, generalization, or drifting of the data. That is the role of the QA when these things happen, how you work out, how you answer to the auditors. Okay, my platform or the model is validated. I have trained it. Okay, and this is my data, what I have trained with all variables I have trained because these variables also come in my test data. So you should have all inclusivity in your train data that you are going to do in test. Then you validate it. get your performance metrics, how much it is, how good it is performing, then give your test data. Okay, this all has to be explained. I will provide you that, I mean, I'll provide you a lot of information like how you can explain this to the auditors. Okay, justification statement. And a lot of auditors will appreciate when you have a good explainability or ground truth. Okay, this is what I have done with the AIML. And later I had my review on that. Okay, I have worked on this, and it is AIML was a supportive one. Then I took the final decision. These all things you should have. I'll give you an SOP on AIML governance. Okay, you should have that governance and follow. And periodically, when you will validate, I said when there is a drift, you need to pre-train them. How many times? When you will, all this has to come in that SOP. Okay, and next class we will discuss on all this stuff that is required from the core concept, stepwise AI model adoption with examples. Okay, what are the risks and limitations? What are the inputs and outputs? Okay, what are the metrics we get? How to find, justify the auditor questions, and a lot of other things like the regulatory compliances. Okay, and what we should not do with AIML. Okay, with this I'll close because I know I need to continue for another 45 minutes because only few are there, and this is very, very important. Of course, I'll be sharing the recording, but I expect, I don't know, I'll keep it in the chat, like when it will be possible for all of you to be there. Because if you miss the basics, I know it is impossible for you to understand what I'll be teaching next. Okay, it will be like you will be in a dark room, like you don't know what to next, because these are the basic things. See, once I go on hands-on experience, suppose I will download ML Azure, okay, and will try to do a decision tree. How you will start, what your data input should be, for which activities you will do, whether it's regulatory or quality, how you will do the input data, how you will do the cleaning of the data. Okay. In decision trees, like I said, you can have random forest, like how many clusters you want. Okay, how you interpret the data and how you will, first of all, interpretation is the second thing. How you pre-train it, validate it. Okay, then do your test, use your test data, look at the performance of it, and how you justify it, the data which you got relevant to the regulatory compliance, how you will answer the auditors. These are all important things which we will discuss in the next class. And thanks for your both of you. I don't know your names, like one is iPhone and one is OnePlus. See you next class. Take care. Bye. Madhusri was there, she left, I think. It's fine. I'll see that Sundays we will not have sessions. It could be on working days, best is on Fridays and Saturdays. We'll see that that's a conducive day for all of the participants. Okay, take care. Bye.
Thank you, sir. Good night.
Yeah, bye. Good night.
Thank you.
Yeah.